I'm trying to make it so that when we finish this chapter and we start on a review, it'll be recorded so you guys can go look back at it if you need to. That's my plan. Here we go. Alright, so still on 357, so we can get this chapter finished. We were talking about a pessary. Again, that is a device that is inserted into the vagina directly under the cervix, and that pushes up against the uterus because, not the uterus, but the bladder, because it's all right there together, the uterus and the bladder. And it pushes up against that to hold it in place. What happens is, for a lot of women, after they've given vaginal childbirth, the muscles are so stretched that every time they go to use the restroom, or laugh, or cough, or use stairs, they have bladder leakage. And that becomes an issue, so then they do this to try to help with that. We talked about a salpingoectomy, and that's in here. Flipping the page. Okay, 358 on the bottom left here, figure 1510, you can see a really good view of what a pap looks like. So, two things. We used to do what's called a pap smear, and that's because they would take the swab and whatever was, and they would swab the opening of the cervix, right? So that's endocervical cells, and they would put those onto a slide. They would also put cervical cells on the slide, and they would do a vaginal swab, and they would put all those on one slide, and we called it a pap smear, like a microscope slide. Now what we do is called a thin prep, which, if any of you have been to a gynecologist recently, you know that it's a little tiny bottle, and they put everything in it, and that little tiny bottle with the liquid in it, that's the preservative, that's the formalin, that goes off to the lab to be tested. So it's actually called a thin prep. But we still book people for a pap smear. Yeah. But that's the difference between them. Alright, and if you see right here under abbreviations on the left, can everybody see what the actual word for what PAP is short for? Do you see that?
Yes.
Okay. So, that's good. Hormone replacement therapy, HRT, hormone replacement therapy. As far as that goes, just know that that involves taking medications. For some women, they have a lack of estrogen in their system, so they need estrogen replacement, right? Especially during like perimenopause, they might need a little more estrogen in their system to try to help kind of break it through. Or maybe somebody who's, you know, maybe just turned 50, 51, but due to endometriosis or fibroids or anything like that, they've had to have a hysterectomy done. And if they've had to have a hysterorphoectomy, that means that their uterus and their what have been removed.
Ovaries?
Ovaries, right. So since the ovaries are what release the estrogen, they now need to have HRT, hormone replacement therapy, to put the estrogen back in their bodies. Because if they don't, then it can make their bones more brittle and make them more susceptible to fractures. That's just one thing. There's several others, like the lack of sleeping, the hot flashes, and the hair falling. Just to name a few. Alright, let's look at 359. The word ablation. What does ablation mean?
Removal of tissue to destroy its functions.
Right. So removal of tissue to destroy its functions. So when we talk about a nerve ablation, right, we're removing a piece of tissue, right, to destroy its function. So we're separating A and B. If we separate A and B, then there's no follow through. So now the function is gone, right? So just like with a vasectomy, right, where the vas deferens is surgically a piece of that is surgically removed. It's a way of looking at an ablation. There's also, you can also have a uterine ablation. So then you have conization. So coniz, C-O-N-I-Z, is cone. Okay? So that's the surgical excision of a cone-shaped piece of tissue. And you're thinking, when does that happen? Okay. So there's a thing called a LEEP. It's a loop electrosurgical cauterization procedure. Yeah. You'll get more of it when we get into clinical procedures, but the gist of it is that the opening of the cervix, that they've done a PAP, and in that PAP has come back that they have abnormal cervical cells. So there's a staining done with, usually it's acetyl acid, it's like vinegar, but they'll put that on there first. That'll change the cells and make them white, and then they'll actually take an electrified loop and they will cut a cone shape out. Kind of looks almost like a top hat. And they'll cut it out of the opening of the cervix to remove any potentially cancerous cells. But that's called a LEEP, L-E-E-P, if you want to look it up. Let's see. D&C, dilation and curettage. Dilation. What does dilate mean? What does dilate mean? Anybody?
To expand.
Thank you. Yes, to expand. So things are going to get bigger. Okay, so in this case, what they're doing is they're expanding the opening of the cervix, right? They're dilating the cervix to make it bigger. Okay, and then curettage, you can see here, means to cleanse. So they're literally scraping the interior of the cavity to remove anything from it. This can be done for several different reasons. That's just what the procedure is called. It's called a D&C. Let's see. Now, dysfunctional. We know what dysfunctional is. Dysplasia. What is plays? P-L-A-S. It's a root word. What does that mean?
Development.
Okay, so bad or painful, difficult development. So conditions of so pertaining to showing abnormal tissue formation. Again, that goes back to having a PAP that may be abnormal on the test return. And once again, of course, a PAP test is another eponym. That's a question, by the way. Eponym. What is an eponym? You need to know what an eponym is for your final next week. So an eponym is what? It's also back in chapter 1, but it's when something's named after a person. So in this one, right, the PAP test, so George Papanalakou, so Greek U.S. physician, 1883 to 1962. Where PAP comes from. Alright. Alright, so coitus, I'm on 361. Coitus means coming together. Postcoital would be after intercourse. In some cases, that equals conception. There you go. So if sept means receive and contra means against. Okay, well, what else means against? What's the other ones? 4 letters, there's the A. What else means against?
Anti.
Anti. Okay, so if we have a contraceptive, what does that mean?
An agent that prevents conception.
Right. So it's working against the person conceiving, right? Because that's what they call it, a contraceptive. So of course, as we know, there's medication versions, and then there are external versions, right? So the external over here on the left-hand side, you can see there, it's got a picture of a male and a female condom. Yes, they both exist. There you go. There's pictures if you did not know. An intrauterine device is called an IUD. That's an intrauterine device. That's not the same as an IED. Totally different. That's an explosive device. So an IUD, kind of shaped like the letter T, sort of, but the two top points have little strings, and they come down. One example of that is Mirena. And why do people like that? Because it lasts for like 5 years. That's why they like it. Because it gets put in, and then they don't have to worry about it for 5 years. Because it's 99% effective for 5 years. And they can just come back and get it changed out, and hopefully everything is good. Okay, so now on 1512, down here at the bottom, figure 1512, you can see what's known as a diaphragm. So two things here. So as a form of contraception, a diaphragm is the little cap, and that gets inserted just like the NuvaRing or the pessary gets inserted in the vagina. And then, of course, the idea is that sperm would not be able to enter the cervix to make its way into the uterus. So when we're looking at the word insemination, semen means what?
Semen.
Semen. There we go. Semen means semen. Okay. So when we're looking at insemination, we see that we're talking about the process of semen and, of course, it being placed within. Keep in mind that, of course, once semen enters that area, it is viable for 5 to 7 days. So just because today's Tuesday, somebody could have had relations on Friday, had intercourse on Friday, and they might actually get pregnant tomorrow. Think about that. Okay. All right, let's see. So then there's progestin. Pro, again, it means before. Gest is produce or gestation. So this is a synthetic form of progesterone. And remember we said that the egg has to have progesterone in order for it to be viable, so it can meet up with sperm to create a zygote. Let's see. Next page. 363. Down the bottom there, you have a picture of a cytoplasm, in case you didn't know. Let's see. What does blast mean? B-L-A-S-T.
Immature cell.
Immature cell. Okay, so immature cell. So when we're talking about a blastocyst, so that's going to be the first 2 weeks of the developing embryo. All right. So a lot of times, of course, after somebody has intercourse, they'll want to know if they're pregnant, and they're going to go and they're going to get a pregnancy test, and that's called an HCG, human chorionic gonadotrophin. That's HCG. They'll go get this test, and then they'll take it, and they'll be like, oh, well, I took 3 tests, and they all said I was negative, but I really was positive. When did you take those tests? Because what they are detecting is HCG. Your body does not produce HCG until you have a placenta. If you don't have a placenta formed, which takes more than 2 days, then you're not going to show positive on a test. So that's a thing for some women. They come in, they're like, I have amenorrhea. You're like, okay, well, what's your LMP? What does LMP stand for? Anybody? LMP.
Last menstrual period.
Last menstrual period, yep. So what we want to know is what's the first date of the last menstrual period. Not the last date, the first date. So if you started on Monday, today's the 18th, so your LMP would be the 17th, right? It'd be 8/17. Okay. So we need to know what that date was, because based on that, if a HCG test shows positive, that's how we can calculate how far out, as far as to when, a child would be due. Excuse me. All right, so on this page you have blastocyst, we talk about that, and embryo, so that's the developing organism. We have embryonic, so that would just be pertaining to the embryo. You can see fertilized, fetus, which is Latin for offspring, and then again implementation, so that would be to implant, so that's the attachment of the fertilized egg into the endometrium. So A equals B, which goes to C because it's implanted into the endometrium. Yep. Okay. We talked about a placenta. You know what that is. Let's see. Amniocentesis. I'm on 365. Amniocentesis. You can see that there. So that means to puncture the amniotic sac. And the reason why they do that is for diagnostic tests, because they want to make sure that there's no birth defects, potentially, with the child. So, chorionic villus, you can see that there. Conception, we talked about that. 367. All right. What does ectop mean? 367, the word ectop, E-C-T-O-P.
Outside place, not in normal position.
Right. So out of place, not in normal position. So if your female patient has an ectopic pregnancy, so instead of that fertilized egg implanting itself into the endometrium within the uterus, it implants itself into the fallopian tube. Yeah. So what does that mean? That means that the fundus, the area there where the fallopian tube attaches to the uterus, the sperm went through the vagina, through the cervix, through the uterus. It swam all the way into the fundus and kept going up the fallopian tube till it found the egg. Yep. And then that fertilized egg decided, oh, I'm here, good, we're ready. No, you're not. No. So what happens is that is an emergency procedure for a patient. They're going to need surgery, obviously, because that is not going to work out. So at that point, of course, that would be terminated, because it's either that or the female. One of the two has to go, and it's not going to work out. So that's just how that happens. It causes extreme abdominal pain for female patients who end up with one of those. Now, gestation. What does gestation mean?
From conception to birth.
Yep, from conception to birth, so all the way from point A to point B, all the way to the end. All right. Let's see. You guys know that oligo is scanty. You know that hydro is water. Poly, you know that means many. IA is condition. Pre is before. All right, preeclampsia. What is preeclampsia? Anybody? Anybody want to take preeclampsia?
It's hypertension, is it edema,
Edema.
and edema, and proteinuria
Proteinuria.
during pregnancy. It's a lot of stuff during pregnancy.
Yep. all of that. It's crazy, right? You're thinking, wow, there's a lot happening. So now let's see here. Really? Okay. So what happens in this one is the patient, and this could happen at any point during pregnancy, but it usually happens towards the latter part of pregnancy. But the patient will experience hypertension. What is hypertension? What's the other name for that?
High blood pressure.
High blood pressure. Okay. Edema. What is edema?
Swelling.
So that's swelling. And then proteinuria. So it's a compound word, right? So the first word is protein. And then the second word is urine, and then your suffix is IA. So when we talk about proteinuria, now you know that means that there is protein in the patient's urine. So it's a condition, because that's IA, of having protein in the urine. That means that the kidneys are not filtering properly. And that has to go along with the hypertension, which is why they're swelling. Yep. That's something that can be worked with, but the patient's probably going to end up on bed rest till the baby's born. So preterm, what does preterm mean?
Before the 40 weeks.
I'm sorry, I missed that. What? Hello?
Before the 40 weeks.
Yeah. So anything that happens before the 40 weeks. I'm trying to think. My half sister, I want to say she was like 15 weeks early with my niece, and she was like, you could hold her in your hand. She was so small when she was born, and it just took her time to get to, where size wasn't a factor anymore. But she's like 11 now, so. But yeah, so a lot of times you'll have patients that are it could be their first pregnancy, or they could have had multiple pregnancies, but especially in the case of someone who has a multi-birth pregnancy, so as in more than one at one time, so twins, triplets, quadruplets, the more that are in there, the more risk there is for a preterm delivery. And that's something to take into consideration, as well as the patient's age. All right, so trimester, what does trimester mean? We're almost at the end of this chapter. What is a trimester?
1/3 of the length of a full-term pregnancy.
Yep. So every 3 months. So full term should be 9 months. So the first trimester is the first 3, second trimester is the second 3, and the last one's the last 3. So let's go to page 369. All right. Autolysis is just self-destruction. Dilation, we know what that is. Effacement, so that's a resulting state of wiping out. So that's the thinning of the cervix in relation to labor. Episiotomy. So episiotomy, it says surgical incision of the vulva. So what that is, if you didn't know, so that's a cut that takes place between, a lot of times between the vagina and the rectum. It'll take place there, and they'll do a cut in order to keep it from tearing during vaginal childbirth. And then they can just stitch it back together. Of course, on page 368, there you see childbirth. If you've never seen a head coming out of a vagina, there you go. It's right there for you. Let's see. Neonate. What does neo mean?
New.
New. Right? So new. So we have a neonate and then we have perinatal. So what does perinatal mean?
Around the time of birth.
Yep. So before birth is prenatal, around that time is perinatal, and then what is the term that means after birth?
Postnatal.
Yep, postnatal. Okay. So if a child is, if it's the first pregnancy, right? So we have a primi, Primi, and that usually means first. So primigravida is your first pregnancy, and then we have gens produce. We already know what that is. I'm not so worried about that. All right, 371. We are almost done. We have 3 pages left. And the whole chapter, the whole book will be done in 3 pages. Okay, so we have abortion, all right? So fail at onset. So now this could be spontaneous or induced, depending on what it is. Just keep in mind that if it's the first pregnancy and the parents' blood types don't match, that's one thing, because the woman's body hasn't yet perceived the man's blood type as an invader into her territory. So it'll be alright. But the second and every pregnancy after that, if the blood types are not the same, right? They're not compatible, okay? So if you have a patient who has, and we talked about blood before, you remember that, but if a patient has type A blood, right, that means that they're good for A or AB, right? Now, there's a thing called a rhesus factor, okay? This came from the rhesus monkey. So whether your blood is positive or negative, this is what makes a difference, okay? If it's positive or negative. So if the female is positive, she's positive, she can handle if the man's blood is positive or negative. She'll be fine. If the female is negative and the man's blood is positive, her body is going to perceive that as a threat. Okay? Just like an infection. Same thing. I'll perceive it as a threat. Now, 2 negatives, you're good. But a negative and a positive, they don't work. So what's going to happen is the female is going to need a RhoGAM injection, and that RhoGAM injection is going to make it so that the blood types mixing, the mother's body doesn't try to kill it. So a lot of times when we say spontaneous abortion, it has to do with the blood types and people just not knowing their blood types and not going to the doctor as soon as they think they might be expecting. A lot of times that's the case. So just keep that in mind. As far as breech goes, breech is Old English for trousers. That just means that the child is presenting buttocks first. It's just going to be a lot harder delivery there. And they have to be careful because we want to make sure that the umbilical cord isn't wrapped around the head. Cesarean section, otherwise known as a C-section, is an extraction of the fetus through an incision in the abdominal and uterine wall. So first the physician has to cut through the abdominal wall, then they have to cut through the uterine wall, and then they can take the baby out. Okay, what is icterus? What is icterus?
Jaundice.
Jaundice. Okay. Does anybody here know what causes jaundice?
It has something to do with your liver.
Yes. Very true. Okay. So it's a buildup of bilirubin. So it's excess bilirubin in the blood for the child, so the child can be born jaundice, in which case they have to be placed under a Billy blanket, like B-I-L-I, like bilirubin, belly blanket. They get placed under that, which another name for that's a UV blanket, and the UV helps the body filter out the yellow pigment. My sister she was born premature, and she was born a month early, and she had jaundice. And my mother thought that it was not her baby. She did not think it was her kid. Apparently my sister was too yellow. Let's see. Sometimes there's no words. Okay, let's see. Conium, we're good there. Placenta abruptio, what does that mean? Placenta abruptio.
The premature detachment of the placenta.
Right, so the placenta is attached to the endometrium, and that's where it should stay. If for whatever reason the placenta detaches from that endometrium, it's going to cause bleeding. Because remember that endometrium is what gives you your menstrual cycle, right? So if the placenta detaches from it, then it has a tendency to want to shed. And that bleeding needs to be stopped, because if that placenta fully detaches from the endometrium, then the baby no longer has oxygen. That's it. Okay. So there's placenta previa, so that's pre or before, so it's in condition in which the placenta is positioned between the fetus and the cervix. So that's placenta previa. So the placenta is now in front of that, right? The placenta cannot come out until the baby comes out, right? Why? Why can't the placenta come out first? See who was paying attention.
Because then the baby won't be getting
Because of heavy
oxygen.
That is correct, ladies. There is no oxygen. Very good. Okay. Prematurity is just a condition of before it's ripe. That's it. That's what premature is. Okay. On the left-hand side here, it shows you a picture of a placenta. So in case you've never seen one, there it is. Now you know why some women are so unbelievably round before they give birth. All right, 373. Okay, let's see. Areola. Areole is areolar, so it's just pertaining to, so it's the circular reddish area that surrounds the nipple pertaining to the areola. Colostrum, so you see the word colostrum there, so it's Latin for foremilk, like before milk. So that's an actual substance that is excreted at the end of the pregnancy. So the very first, 1 to 3 days after a woman gives birth, there's colostrum. That colostrum has a lot of things in it that the baby needs. One of which is all of the antibiotics that are going, I shouldn't say antibiotics, it's everything that's going to coat the GI system. So it's everything that's going to help the baby's immune system. That's where I was going with that. So it coats the entire GI tract, and it gives them some of their immunity. Helps with a lot of things. Children that are not breastfed directly after birth have a tendency, so they don't get that colostrum, they have a tendency to have a lot of GI issues later in life. Let's see. So this is interesting. So let's look at this. So what does lact mean? L-A-C-T. What is that?
Milk.
Milk. Okay. So what does the word lactiferous mean? Lactiferous.
Pertaining to or yielding milk.
Very good. Okay. So the milk, of course, comes from the mammaries, which mammary or mam is breast, right? And These things, especially prolactin, so the pituitary hormone that stimulates the production of milk. For a lot of women, it's the scent that the baby puts off. If you ever notice, for any of you that have children, I guarantee you that you are sniffing their heads. It's just a mom thing. It's what moms do. They sniff the heads. You smell the infant, and then that smell goes to your pituitary hormone and causes, right, that prolactin, right, that causes the milk production. So it's that smell. That'll do that a lot. As far as oxytocin, so oxy means oxygen, TOC means labor. So oxytocin, all right. So it's pituitary hormone that stimulates the uterus to contract, which is why if you go into the hospital, they give you what? They give you
Pitocin.
Pitocin, right, a synthetic version of it, to help you go into labor. Like my sister, when she went to, I love my sister. So she sat there and she thought that it was her first kid. So she picked her stomach up and or her uterus, however you want to look at that, but she picked it up and moved it kind of left to right, side to side, and she was like, check this out. And I was like, oh my gosh, what are you doing? So her water broke. Like 2 weeks early. She was about 2 weeks out. So her water broke, so they ended up having to do Pitocin at the hospital to put her into contractions because her water had broke. And then they had to do a C-section. They gave it 24 hours and the kid wasn't going anywhere, so they did a C-section. But that's just an example of how that would happen and why you would need that. The other reason, of course, is if you have a scheduled date with your doctor to get induced, then of course they'll give you the Pitocin. 375. Oh my gosh, it's the last page. Okay. Anti-neoplastics. So neo means what again?
New.
New. Okay, plas, P-L-A-S means what?
Growth.
Growth. Okay, anti means against. So an anti-neoplastic is going to be something that prevents the new growth. So when we talk about cancer drugs, we're talking about anti-neoplastics because they're gonna prevent that new growth from happening. Fibrocystic disease, you can see that. So fibro is fiber, cyst is cyst. Galactorrhea. What is galactorrhea?
Abnormal flow of milk from the breast.
Yeah. So it might be that maybe someone is done and they think that they're done with their pumping and everything is good. An hour goes by and they look down and their shirt's wet and they're like, how? Right? It happens. So that's one good example of galactorrhea. It's an abnormal flow. Like, where did this come from? It could also mean that maybe the mother is pumping, but it's not sufficient. That would also go in that category. Gynecomastia. What is gynecomastia?
Enlargement of the breast.
Right, enlargement of the breast. So we've talked about this a little bit before, but you know how milk now, if you go to the grocery store, you see milk and it says non-GMO or no hormones, right? So GMO is genetically modified. The reason why you see that now is because in order to keep up with human consumption of cow's milk, which if you think about this, we are the only population on the planet that strictly does not consume our own product. We drink the milk of other animals. Okay, so, which is weird yet interesting at the same time. So what happened is that in order to keep up with the consumer drinking of milk, cows were injected with hormones to make them think that they were still pregnant. And in the dairy industry, that's called fresh. And that would mean that they just had a calf. And So in order to keep up with that, they gave them hormones. Well, the hormones went through the milk. So then young boys started developing breasts. And this happened probably 20 to 30 years ago. There was a lot of issue with it, especially 20 years ago. There was a lot of issue with young boys, like, out of nowhere. Like, we're talking like A cups, maybe B cups, depending on the size of the kid. And it was like, where did that come from? Why are all these boys ending up with gynecomastia? And they figured it out. It was due to the hormones in the milk. To this day, if you look at a lot of young women, they tend to look a little more top-heavy. You'd see someone who maybe needs like an extra large shirt but a small pair of pants. They just a little bit disproportionate. And that's what the gynecomastia is. But they stopped putting, of course, hormones to cows, trying to make sure that that milk production is natural. So that's why you see that non-GMO on a lot of milk products, or dairy products. Okay, what's a lumpectomy?
Removal of a lesion with preservation of surrounding tissue.
Yep. So as a female, if you happen to do your monthly breast exam, which everyone should be doing a monthly breast exam, even men should be checking for any masses, and breast tissue also goes under the arm, so don't think that you exclude that, because it goes from under the arm all the way across. Right arm up, feel the right one. Left arm up, feel the left one. I don't care what pattern you use. If you start at the outside and work your way in, or if you start at the nipple and work your way out, nobody cares. As long as you stick to the same pattern. That way, if you feel something that's kind of squishy, then that might just be lipose, right? So fat. But if you feel something hard and you can't, it's not moving, it's a hard lump, that's a problem, and that's something that needs to be addressed with the physician. So as far as women, as far as our bodies go, it needs to be done like the Sunday after your menstrual cycle. So if you started on Monday, that means that Sunday you would be doing your self-breast exam. And the reason why that's done is because that's when you have the highest level of estrogen in your system, which is why women are always emotional during that time of the month. But you have the highest levels of estrogen in your system, which makes your tissue more sensitive, and it's easier to find a lump if you have one. Now, for men, they can also do a self-breast exam every month. That's fine, but they also need to do a self-testicular exam, and that's where they take the thumb and the fingers and they move the testicle around in them like this, and they just work their way all the way around the testicle, same as the breast. Pick an area, work your way in or out, and make sure that you don't feel any lumps, any hard lumps. Let's see. All right. What is mastalgia?
Pain in the breast.
Pain in the breast, right? So sometimes different conditions will present with mastalgia, and that's going to be something where it needs to be looked at to see whether or not the patient is actually having an issue with that, to see exactly what it is that's causing that to happen. Okay? Alright, and then mastitis is inflammation of the breast, and what is a mastectomy? What is that? What is a mastectomy?
Surgical
Excision of the breast.
Right, surgical excision of the breast. So you can have a mastectomy, or you could have a double mastectomy, right? So it's either one or both. And that's something that can be done on men or women depending on what the issue is that it needs to be done for. Some people want to check to see if they have markers for breast cancer, because breast cancer is so deadly. So they want to check to see if they have the markers for it first. So there's a thing called a BRCA test, and I helped a patient with it one time. You just scope, and you have to run your tongue across your teeth so many times that you spit into a tube, and you send it in, and when you send it in, they check it and they see whether or not you have the genetic markers for having breast cancer. So to give you like a famous example, Angelina Jolie, she decided that she took a test and she found out that she had the markers for it, and she went ahead and had a double mastectomy done, and then just went ahead and had implants. That way she wouldn't have to worry about that anymore. That's just no longer a concern. They're gone. But that's an example. Okay, so we are done with chapter 15. Are y'all happy? I'm happy. Are y'all happy?
Yes.
Good. Okay, so I'm just going to work my way across the screen here. Tell me something new you learned, because I would like to know. So, Mr. Brown, is there anything new you learned in this chapter?
Information regarding the placenta. I did not know it looked like that, even though I was in all of my kids' birthing rooms.
Yep.
Good enough.
Yep, you're like, oh. Well, and there's some countries that, require you to eat it afterwards, and I'm like, But yes.
They can have that.
Yep, nope. I've seen a lot of videos where people have done some interesting birthing techniques. I do have a student right now who she's in 230. So no, she's in pharmacology right now. She's gonna be in 230 next term, and then she'll be going out for her externship. But she just got certified as a birth doula. And do you guys know what a birth doula is? Just curious. No? Yes?
I'm sorry, what'd you say?
Do you know what a birth doula is?
Yes.
You do? That's good. Somebody said yes.
My sister-in-law used one.
She's a birth doula?
No.
Oh.
She used one when she was pregnant.
Okay.
That's the assistant.
Yep. So a birth doula is the person that kind of helps you prepare, and they stick with you after the child is born for, I think it's like up to like 6 months, just if you want to keep them around, where they kind of help you to understand, what to expect and how things go, and kind of helping you make sure you have everything you actually need and answer random questions, and it's kind of like having your go-to person. So there's birth doulas and there's death doulas, and that's an actual thing. But they're just people who are there for you during whatever process it is, and they know it from beginning to end, front to back, and they're there to help you answer your questions, kind of like having your own like little personal cheerleader coach that gets things done. All right, Dorothy, tell me something new you learned.
I learned about the lactation in the late pregnancy.
Mm-hmm. Yep.
Yeah.
And it gets interesting. I've seen a lot of different things over the years. And I had one patient who stopped breastfeeding. 6 months went by, and her breast got really, really sore, like super sore. And I actually helped my physician. This was crazy. Never seen anything like it. He took and injected a little bit of Lido with epi, so a little local anesthetic, around the nipple area, so into the areola itself, and just to kind of numb it up some so it wouldn't be so bad. And then he used a needle, like needle and syringe, but he just used the needle part to actually open the duct. Because what had happened is the duct had gotten clogged after she stopped breastfeeding, and it ended up swelling up and causing a lot of pain on that one breast. I thought her husband was going to pass out, I'm not going to lie. Just watching another man come at his wife's nipple with a needle and to unclog it, I thought her husband was going to pass out, but he survived, so that's good. Okay. Let's see, Jennifer, something new that you learned.
None of that was really new to me. I kind of.
That's because you have kids. Okay. Gotcha. All right. What about you, Jen? Anything new for you?
Well, I have 2 kids and I learned a lot. I think I was a little bit traumatized by the prolapse uterus.
Yeah, that's a graphic picture, but that's what it looks like.
I'm
Now
just
there.
glad, I don't know. I'm glad I didn't know about it, honestly.
Well, now there's a thing called a prolapse vagina, so that's something else as well, and that's where the vagina, where the muscles that hold it in place, can become stretched over time, and the vagina will actually start to come out of, it'll drop down, below where it should be, below the vaginal opening. It'll drop down below that, and that's what they were talking about, that PEXI, where they have to do that surgical fixation. Yeah,
Wow.
that can happen too. Yeah. All right, Amanda, what have you learned?
Nothing new really,
Okay.
except for, the smelling of the head produces milk. I
Yep.
never got I smelled all my kids' heads, and I still don't understand what people are smelling.
It's just one of those things. Sometimes it works, sometimes it doesn't. But that's why a lot of times if mothers like return to work and they're not around their kid all the time, that their milk will dry up faster because they're not like in constant contact with them. That's one thing. I mean, some people, their milk production isn't there. One of my cousins, his daughter, she's 26, 27, I think, and she just had her first child, and she was really upset, like completely upset. Like she put this huge thing out on Facebook about how upset she was that she wouldn't be able to breastfeed her son because when he went in for his 30-day checkup, they told her that he wasn't gaining enough weight. So that she wasn't actually producing enough, or at least not a quality amount of milk for him. So he was going to have to go on bottles, and that just tore her up. All right, let's see. Who have we not talked to? Is there anybody else here? I'll check. Anybody else here right now? Besides the 5 people I just talked to? Okay. There's like a whole lot of thing going on there. Okay. All right, so let's get to your review for your final. All right. A lot of word parts. You've each done somewhere between 50 and 150 flashcards. Okay. Just make sure that you send me your cards. Make sure that you send me a picture of them, preferably between today and tomorrow, so that I can check them off in the grade book, because those are also a competency. So you actually do get grade points for that as well. Now, as far as all the words go, there's a lot. There's a lot.
Miss Amanda, you said we should send you a flashcard.
Yep.
Okay.
Yeah, you can just send me a picture. If you wrote them out on actual flashcards, that's great. Just send me a picture. If for some reason you typed them up in a Word document, that's fine. Just send me the Word document.
Okay.
No big deal. Yep. No big deal either way. So as far as those go, just to give you something to use to study with, I'm going to post like a 4-page deal. And you can print this out. It's kind of like a matching, right? Where you can say, okay, well, this says prostato, so I know that that's prostate. Or this says uro, so I know that that means it's urine. See what I'm saying? Yes? No?
Yes.
Thank you. Okay,
Yes.
so perfect. So I'm going to post that here very shortly. I should have that on my flash on the hard drive I have here. If for some reason I don't, and it's on my actual flash drive that's in my classroom, I will post it tomorrow afternoon. But hopefully I should have a copy of it on my hard drive. So I try to keep backups of everything because you just never know with electronics, as we've learned by class 2 weeks in a row. So anyway, just make sure as far as your I also give you like a little worksheet you can do that I made for y'all, and what the worksheet is. And I don't know if I can share this or not right now. Let me see if I can share this. Because I made y'all like a little worksheet. Let's see. It'll help y'all. Lordy. Okay. This one, maybe? My screen is crazy. Can I go there? Nope. This one? Share your desktop. Let's see. Let's see if I can share my desktop. There's a lot going on my desktop. Can you guys see my desktop now? Can you see this? You should be able to.
It looks like it's loading. There it is.
Yes.
You see it? Okay, so I'm going to post this up. So I made this little worksheet for y'all. So you can actually take your 50 flashcards that you did and kind of write them out. If you're anything like me, hands-on is better. You're probably very didactic. Most people that like medical and things like this, you're very hands-on. So if you're like me, and that's your deal, this will really help you. So write down your word part, like I put auto, and then you know that that's, okay, my bad, I need to put the forward slash, there we go. So you know that that's a root word, and it means ear, and then you can use it in a word. And that'll help you remember your word parts. So like if I went here and I said, okay, well, I want to use itis, right? So what part of the word is itis?
Suffix.
Thank you.
Suffix.
Yeah, it's a suffix. All right. And what does it mean?
Information.
Right. Okay. And then, so if I'm going to take a word and let's say maybe I want to say inflammation of the ear, right? Otitis. There we go. So I'll post this one for you. I made this for you guys so it gives you something that you could, print off, or you could just, copy it like in a notebook so you don't have to actually print anything. But you can make your little categories like this, and it should help you a lot to try to remember these different word parts. Like I said, there's a lot of them. It's a whole nother language, so there's like a lot of them. I just want you to have as much information to use as possible going forward. So we'll try. It's 8:29. We'll do a couple. Oh, you know what I'll do for y'all? I know what I'll do for you guys. Hold on. Let me see if I can figure out how to. Well, if I can share my screen, you guys should be able to see this. All right, so check this out. I'm gonna go to. No, I need the K, not the C. So I had a student a couple terms ago make a Kahoot for the final in midterm. Actually, no, I can't do it this way. I'm gonna have to pull up my old class and actually get the link for you. So I'll find that here in the next hour or so, and then I'll post it. And it's like, geez, probably 100. It's at least 150 different word parts. Where's my screen? Nope, sorry, wrong screen. Nope. Okay, this one? Is this the one I want? Okay, I don't want to share it anymore. How do I stop sharing it? It hates me. That's what this is. It hates me. That's all I get. Okay, there's everybody. This thing has been nuts for me tonight. Oh, hold on, there it is. Stop sharing. Yes. Okay. So what I'll do is I'll put the link up to the Kahoot here in a few minutes, like somewhere in the next hour. I'll upload this sheet for you, and then I'm going to give you a matching thing that you can do, so that you have a bunch of different versions to play with to try to make sure that you get your word parts down, because that's going to be the biggest thing is remembering your word parts. And then that way you should be able to fly through the final. Now, as far as how we're going to do the final, okay, question for y'all. Okay, do you guys want to do the final online, or do you want to come to campus?
I prefer online only because right now my husband's schedule, I can't come to the campus.
Gotcha. Okay. That's fine. I just figured I'd ask. I was throwing out an option. All right. So if we're going to do online, the way we're going to do this is we will log in at 6:30 next week, like normal. We'll log into Blackboard and hope we survive. Okay. We'll do a brief review. I will have the final up and available from the moment class is over, and we'll do a review from, like, let's say 6:30 to 7. Okay. We'll do like a 30-minute review. We'll be done at 7 o'clock, and then you will have from 7 to 9 to take the final. And then that way it'll be just like if you were in class. You'll have 2 hours to take the final. You take the final. Your grade will go in. If there's something that I need to review, it'll give me, like another day or two to review it so that I can get your final grade. Once I put your final grade in, I will send you an email with thank you so much for participating this term. Your final grade for the class is this. Because I always tell people, like, I try to tell everybody the same day, because I hate having people to wait to try to figure out what their final grade is going to be in a class. That drives me crazy.
Ms. Harris, is it timed?
Yes.
How many questions are those?
How many questions is going to be? How many questions y'all want it to be?
You don't know.
I have made tests that have 200 questions. I have made tests that have 50 questions. The reason why I ask is because every group is different. Every single class, I don't care if I teach the same class twice in the same term. Every class is a little bit different, and you kind of have to feel things out as you go. So you guys tell me, do you want 50 questions? Do you want 200 questions? Do you want 100 questions? You tell me.
10.
10?
Yes.
Yes.
200 is a lot of questions. Oh my God, no.
Yeah, it is. But then think how much you learn. Okay, because you're going to have 2 hours to do it. So how many questions do you want, seriously? Got to be more than 10. It's a final.
30. Our brains are a little fried from all the other stuff that's going on.
So you want 30?
Yeah.
Okay.
33 and a third. So it can be 3 points each.
Mr. Brown. Mr.
Yes.
Brown. Like, I'm trying to... You're giving us more. You said 10. I said 30. And then you want to say...
But you got to have 3 points each.
Actually, your final is 30% of your overall grade.
Oh my. Is it optional? You have to type it in. Is it like like A, B, C, D, or we have to type the answers in, or we can just do?
No, so if I do 30 questions, you're gonna have some fill in the blank. I'm not gonna lie, you're gonna have some fill in the blank where I may give you the definition of a word and you need to give me the actual med term. Like if I said inflammation of the ear, you could tell me that is what?
What else?
Otitis, right?
Okay. Yeah.
Otitis. So you might have a couple like that. The way I'm going to do this then is I'll make a pool of 50 questions. You guys will have 30 questions. So that means you will have 30 minutes because it's always 1 minute per question. That's just standard. So you'll have a pool of 50. The computer will randomly pick 30 of those that you will get. Okay, and that's just for test integrity. So you'll get 30 questions. You'll get 30 minutes, and it's 30% of your grade.
Okay. I'm confused. You say you're gonna give us 30 questions or 50 questions?
30. It's gonna be 50 in the pool, but that's because you have to have more questions in the pool. Otherwise, it's just a test.
Okay.
So I have to have something for it to draw from. So
Okay.
I'll come up with 50 total questions. You're gonna get 30 of those randomly. They're always random. That's because I checked the box that says random. And then, like, not everybody. It potentially could be that you all get one question, but the answers will be like in all different variables. So somebody might have A, B, C, D, but the next person, their answers might be C, B, D, A. It's just for test integrity. It just makes it so you can't have two people texting each other, ooh, question number 2, what'd you put? So.
Yes. Okay. Thank you.
Try to make it as legit as possible. Which is highly complicated in the virtual format, but I try to make it as simplistic but as legit as possible because I want to make sure that you really feel like you've learned something this term. Because going into the rest of your career in medical, it's all going to be based off of this. Midterm. Which is the one class that everybody thinks they survived, and then they're like, okay, well, I made it through midterm, I'm good. No. You're going to keep using this. It's like basic math. Alright, so 30 questions, 30 minutes. We'll do some multiple choice and some fill in the blank. We'll leave it at those two. I don't think I'm going to do any matching. Could do matching. Might. Maybe not. We'll see. But any other questions?
How about matching and multiple choice?
Still going to get fill in the blank. Maybe. It depends on I might put like out of those 50 questions, I might only make 5 of them fill in the blank. It just depends on what you get in, how it pulls the questions. So, but it'll be a combination of those 3 things. That way you don't get kind of bored with all multiple choice, because that's just, it's easier, but it's boring. Yeah. All right. What else? Anything else?
I have a question, but it doesn't pertain to the this class.
Okay.
At the beginning of class, you said that next term starts on the 16th, because on
The
my
9th?
schedule it says it's the 9th.
Yeah. No, it
Yeah.
got pushed back. It got pushed back
Okay,
another
I'm
week.
just making sure that I don't.
Yeah, no, we pushed it back another week just due to COVID, honestly, and because usually the way it works is between the April and May, between the winter and the spring term, we get 1 week, and then this time of year we get 3 weeks. That's usually how it works, but because of COVID, we ended up with 3 weeks in the spring, and then we were going to have 1 week now. But because of COVID, and then everybody trying to figure out how they're going to take care of their kids going to school, much less them going to school, they pushed it back a second week just to give everybody time to try to get their kids squared away, and then before your classes start. Because I know it's a lot.
All right, I got a question, ma'am.
Uh-huh.
7.3,
Yep.
that 70 question ordeal. I don't recall us doing that in class. Or was
7.
that 7.3 or 7.4? One of those.
No, we didn't do those in class. Mm-mm.
So we had to do those on our own. Good enough.
Yep. I mean, look at it as more study review.
Ah,
The easiest way. More review is better than no review. But yeah,
like the way you think.
I didn't make that, but I guess you'll get there. I have faith in you. On the other hand, if you go through and because remember the ones for this week are due by this Friday, and then there's no other assignments after those. Like there's no assignments in week 15. The only thing we're going to do for next week is literally we are going to have a 30-minute review, and then I'm going to sign off, and then you guys are going to have 2 hours to complete a 30-minute final. And then that'll be it. And then you'll be done with midterm for now.
All right, sounds good.
I try to have a plan, but you always have to make that amenable because you just never know. Things happen, like Blackboard Collaborate 2 weeks in a row. Go in. All right. Any other questions? Anything else I can answer? Oh, so there's a survey you guys should be getting, like an end of term survey. And it's about your classes, your instructors, that kind of thing. If you don't see it when you log into like my BSC and you hit the big orange box, and it shows you your classes on the left. When you scroll down like under your classes, like under them on the left hand side, it should say survey, and you should see it there. So, I'm not sure if you guys have gotten the link on that yet. It always posts like in the last 2 weeks of the term. So I don't know if you actually seen that yet or not. But just mental note, it's coming. And yeah, there's always surveys. They love surveys. Everybody loves surveys. Like, what kind of salad are you? Random Facebook ones. What kind of princess am I today? Okay. Anything else? Okay, once, going twice. Okay. Well, at that rate, I hope y'all have a wonderful rest of your week. I will get these other things posted for you pretty quickly, and then somewhere within the next hour, hopefully. And if you need anything else, you know how to get in touch with me, Skype or email, and you know I'm here for you. Okay?
Thank you.
You're welcome.
Thank you.
Thank you.
Have a good night.
You
Good
too.
night.
Bye, guys.
Thank you. Have a good night.
Good night.
Bye-bye.